I'm giving an IA, I will say, I'm going to be putting a big bubble in your cheek. It's going to stretch your cheek really big. So you'll definitely feel that. A lot of kids say it feels funny, but it's normal. Just the most important thing you need to do is hold still. And you're going to feel me like shaking your cheek, or if I have an assistant, I will have them spray water and suction at the same time. So if you have multiple things going on at once, then they're not focused on what's actually going on, that there's a poke back there.
I don't say sorry to patients, because if I say sorry to them, then that implies that I've done something wrong. I haven't done anything wrong by getting them numb. It doesn't feel great, but I'm trying to help them get through the appointment. And that not only helps them know that I'm not doing something wrong, but it also helps me because it's hard. It's so hard to do this to little kids. It can be really taxing emotionally.
A tale of two hygienists.
Welcome back, listeners, to A Tale of Two Hygienists podcast. We are your hosts, David Torres, and I am here with the best co-host ever, my periodontal partner in crime, the
Ooh, I like
SRP
that.
specialist, the tartar terminator, Ms.
Jessica Atkinson, Tartar Terminator. I need a T-shirt that says
That's awesome. I love
Tartar
that.
Terminator. I really like that. That was a good intro, Dave. Good intro. I just found out today that Dave feels more adult when people call him Dave. So this is what I'm gonna have a new habit of calling him Dave, because I already have created a habit of David. So it's gonna be if I slip into Dave, I'm sorry. But
It's okay. I get it. Like, you would think that after having 3 kids, that's what's going to make me feel like an adult, but no, apparently just a whole new identity.
Yeah, when I say David to my husband, it's usually when he's in trouble. So Dave's,
Oh, oh.
So we are lucky today to have two of my fave coworkers ever, the illustrious dynamite duo. And now I feel like I need to make some alliterations. Calculus, controller, tartar, terrorist. Dave, you were much better at this. I'll leave that to you.
The
And
bicuspid duel.
that was good. So we have
Pediatric
with us today
princesses.
talking about say that again, Lindsay.
I said pediatric princesses. I don't really feel like a princess, but it
yeah,
was the
me
only
either. Yeah, that
Oh, well,
works.
we hope today you do. I hope that this moment you guys feel royal.
Thank you.
You're welcome. And we're going to start by introducing our royalty today. We have Lindsay with us and Brittnee. We have Lindsay Richmond. I should probably tell you the last name so that they can stalk you and see how great you are. And Brittnee Thibault. And I have the great opportunity to work with these ladies. And I'm going to have them tell you a little bit about themselves, like where they went to school, what they're doing. And then we're going to talk about why we're having them on talking about pediatrics and in particular anesthesia and peds. So we'll start with you, Brittnee, alphabetical order.
Okay, perfect. Well, yeah, I'm Brittnee Thibault. I've been working in pediatrics for around like 12 years, starting as an assistant, and then I went to hygiene school, and then I did pediatric hygiene. So, um, I've been a hygienist for 7 years, 8 years, 8 years, and then I've also been a part-time adjunct instructor at Utah Tech.
That's where we know each other.
I know. It's been the best. I've been there for 7 years. And yeah, I'm a mom of 3. I just had a new little boy.
He's the
Yeah,
cutest,
he's
patootiest,
so
judiest.
cute. I'm obsessed with him. So, yeah, I mean, is that great? Is that anything else? Anything
That
else
was
you need?
great. I would
Okay.
like to know, and at the extra of your intro, what would you like to be known for? Like, what would be on your epitaph of hygiene?
Ooh, I mean, definitely local anesthesia, just, keeping it chill and not getting stressed about it and just being prepared. I think, yeah, I don't know.
That's a great epitaph. That is great. Okay, Lindsay, tell us about you.
Hello, I'm Lindsay Richmond. I have been a hygienist for the last 13 years. I graduated from what was formerly known as Dixie State University, now Utah Tech University. And I have worked in pediatrics at the same pediatric office for the almost 13 years. And that is where I met Brittnee. So Brittnee and I worked together. So I worked with Britt. I was a brand new hygienist and she was a brand new assistant. So we worked together. And then she went to dental hygiene school. And then she came back to our office to work as a hygienist. And I must say this about Brittnee. She is amazing.
It's true.
All of our coworkers, no one ever has anything bad to say about her ever. She is one of the best. Patients love her. She is so professional. It's ridiculous. And she is just extremely good at her job. I always joke that Brittnee and I, so we work at the same places. I too am an adjunct instructor or was an adjunct
She
instructor.
left
not-
me.
I'm so sorry. At Utah Tech. So Britt and I work in the same places and we
Yes.
never work together
Yeah.
because we would work opposite days.
Yep.
Like
because we were
ships in the night.
Mhm.
yes. And so that, and I always say that is the worst part of my job is that
Yes.
I work with Brittnee and don't get to work with Brittnee. It's really
Yes.
rude.
Yeah.
We also found out we
So
were pregnant with our 2 girls at the same time, so
we did.
Oh,
both
Yep,
were
we have
surprises.
girls.
that's
Yes.
a bonding moment.
It is a
It
bonding.
was.
We have followed each other career wise and then also motherhood wise too.
Mhm. Yep.
So the same age, and so we're always bonding
Yes.
over that.
Mhm.
Yeah. So yeah, I've been at that pediatric office for the last 12 years. We work for the best dentists ever. They're
Woo woo.
so good.
The
Britt.
best.
And
We love
let's
that.
see, what else do I do? Was an adjunct instructor in pain control because at our pediatric office we get all of our patients or our doctors' patients numb
Woo
for them.
woo. And that is why we have invited these 2 wonderful humans with us today, because we want to talk about, probably for me as a brand new hygienist, the thing that made me most nervous is giving anesthesia on a pediatric population. Because I don't know about you, but when I was in hygiene school, I did not ever give an injection to a child. Did you, Dave?
No.
Well, I have a sad reality, guys. I'm in Florida,
Mm.
and we can't do anesthetics on anybody younger than 18 years old.
Oh,
So
wow.
naturally, I got questions for you all. But you see how your jaw
Ooh.
dropped? Imagine how I feel every day. But
Aw.
essentially,
Under
yeah, no, I haven't.
18.
Yeah,
Womp womp.
Oh,
I
shoot.
know.
Well,
I
okay, so I'll tell you my story then about entering into the professional world and my first opportunity to give anesthetic on a pediatric patient. He was on what they call a kitty cocktail. And
mm,
Mhm.
if you listen to our last episode with Dr. Johnson, it talks about what's in that kitty cocktail. And this kid was not kitty cocktailing. He was not, it was not working. And he was on nitrous and he was not having it. And I was shaking. It was like I was taking
Mhm.
boards again. I was like, what
Yeah.
is wrong with my hands? And this
Yes.
was a moment for me to recognize my own limitations and look at the situation. And I said, you know what? This is not going to be good for the patient, and it's not going to be good for me to have this be my first experience giving an injection on a kid. So I had a great colleague. She came in and she showed me how she does anesthetic on a kiddo. And she was like bomb.com, the other hygienist. And she
Mm.
just was like, talk calmly, what like and granted she'd done this thousands of times, but just an awesome opportunity for me to see that it was doable and that I didn't need to be as concerned
Mhm.
and that I made the right decision to be a watcher, not
Mhm.
a doer at that moment.
Yep.
So, how do you approach a situation where you have done injections on a population 18 plus and then be put into a situation where this population shrunk?
yeah, yeah. Like the day of tomorrow, Flora could be like, "All right, guys, welcome to the Pete's world, right? Like, what advice do you guys have for me, or what is the main differences between an adult and a child when it comes to anesthetic?"
Yeah. So this was a question I got asked when I got hired at my office. Was my dentist asked, "So how do you feel about local anesthesia?" I'm like, "Great, just passed my boards."
I'm
Good.
ready.
He's like, "How do you feel about pediatric or injections on kids?" And I was like, "Never done it, but willing to learn." And luckily we did have really great mentors.
Mhm.
Doctors were like our mentors and taught us a lot of different tricks. But obviously the first thing that comes to mind is you have to know your max dose because we're
Okay.
working on little children. And so you got to know that right off the bat. If you got a tiny kid coming in there, then you need to know your max dose. And then also, you really need to know your anatomy because if you give them an injection and it doesn't, for example, like a lower block, and you're not in the right spot, then what do you do? Because if you're already at your maximum
You're like,
or look,
whoops.
Something that was like an aha moment for me. I don't know why it like took me to be like, oh, I can give a mental injection or an incisive. Sometimes those two things are used interchangeably, but to be particular, give them an incisive injection. Be on those baby molars because those are your little premolars, and that could be enough. That was like, oh, aha! I don't have to be given an IA to this kiddo because he doesn't need it.
Mhm.
Well, and I would imagine it's for different procedures. Like, when I give local anesthetic, I'm doing SRPs. Guys, we don't do SRPs on kids like that.
Yeah.
You know what I
Mhm.
mean? So we're thinking numbing quadrants, we're thinking numbing tissues.
Mhm.
And tell me, please, like, share an amazing story that you have had about managing the patient because they're kids. They don't, they go to the doctor and like, oh, I'm going to get a shot, right? It's never going to be, although I would argue also that some adults behave like
Oh,
children
yeah.
when it comes to
Mhm.
injections, right? But the verbiage that you use, how do you talk to them? Do you show them the needle, or do you not show them the needle? Like, how does that work?
Yeah, that's a big I think you have when you first bring the patient back, you just have to analyze what is going on. What do they know about the appointment? You have to look at their mannerisms. Are they cool? Do they not really care? Are they like hiding behind mom? It all starts when you bring them back. You have to talk to them. You have to, I love your shoes. What Paw Patrol character is your favorite? Just trying to
I'd be
begin it.
sunk.
Try to begin that conversation, like, if they're answering you, no problem, then you're like, "Okay, we'll see how the next step goes." And the next step in the appointment would be talking to the parent, talking about their history. Have they done this before? I mean, sometimes we know we can read the note, but it's also good to talk to the parent and see if they have any more information, seeing if they need nitrous. You know, definitely recommend nitrous a lot. Not only does it help with the anxiety if it's there, it also kinda blocks what you're doing. They can't see what you're doing if they have that huge hood
Oh
on.
yeah, then it was yeah.
Yep. So, yeah, seeing if they know what's going on. If they, don't really know, then you don't personally, I don't like to tell them that you're getting a shot. Shot is just a no-no. That is a bad word in our office.
Mhm.
So,
Well,
you definitely have to kind of phrase things in a different way, tell them that they will be experiencing something different. You don't need to say the word pain. That's also a no-no. Owie is a
Mm,
no-no. So my go-to is I really love to tell them that they're getting a bubble in their cheek, This bubble's especially so I do like to give IAs on kids, especially because if you just do like a mental or incisive, they do have a large cavity, doesn't always work great. And
Good to know.
you want to be sure that they're really numb because if the dentist goes in there and they're freaking out about, you don't know what they're freaking out about. Is it pain? Are they worried about the vibration? Do they not like the suction in their mouth? Like you want to be sure that they're numb. So I do give IAs most of the time, unless it's just a little tiny thing,
me too.
I'll I'll try and keep it minimal just so we don't have cheek biting and stuff like that. But yeah, most of the time when you're giving an injection on a child, if they have restorations that need to be done, usually it's those baby molars in the back that are touching, and both of those teeth need to be numb anyway. So and they wanna use a rubber dam, so you would have to get the lingual side numb if you didn't do an IA and a lingual block. So, anyway, back to what I was saying. I actually don't remember what I was saying, but
You were
Your
talking
words.
about what you were your words that you use. You say a bubble?
yes, a bubble. So, if I'm giving an IA, I will say, "I'm gonna be putting a big bubble in your cheek. It's gonna stretch your cheek really big." So, you'll definitely feel that. A lot of kids say it feels funny. but it's normal. Just the most important thing you need to do is hold still, and you're gonna feel me like shaking your cheek, or if I have an assistant, I will have them spray water and suction at the same time. So if you have multiple things going on at once, then they're not focused on what's actually going on, that there's a poke back there. So if they have some cold water back there, it kinda gives a different, another sensation to what they're feeling, so it's not just the one thing. So
Wait a minute. So what I'm hearing is Brittney and Lindsay is that you guys are magicians, right? Like, I'm gonna go ahead and do the master distraction, but boom, magic trick. You have a bubble in your cheek, type of thing.
mhm.
That's fascinating. Thank you for sharing that because I have another follow up question. So bear with me because now I'm excited. But I saw my 4-year old last week for dental cleaning, and he knows that I do this for a living. And he saw that I was sitting him in the chair, and actually, my wife is a hygienist too, so she was seeing the other kids, and she was like, "You gotta take care of the baby," which is Jacob.
You get the 4-year-old.
Yeah,
Lucky.
she she was like, "I don't think he trusts me," right? And I think that's what she said is trust, and I didn't understand that, but being able to talk to him and show, because I do show him, right? Like, obviously, I'm not numbing him, but I'm showing him the process of doing a cleaning. He asked me 3 times, and I counted. Is this gonna hurt? Are you gonna hurt
Mhm,
me? Is this
mhm.
gonna hurt? Right? And then I just stopped answering the question and I was like, Papi, why would I hurt you? Right? Everything I do is to make you
Mhm,
better or make it better. Right? How much time do you guys have? Because I hear that you guys are known for the amazing dentists that you work with. How much time do you have to kind of build that trust and have that relationship with your patient? Because I mean, I built trust with my 4-year-old, so that implies that I had 4 years to kind of get to that moment. But how do you do it with strangers and most importantly, also their parents,
mhm,
right?
Yeah. So I would say it depends on the day, obviously. Sometimes you have more time to work with a patient than others. And also, I think, like Britt said, you start evaluating right away what they're going to be able to tolerate. So if I come in and a patient sits in the chair fine, they lay back in the chair fine, they start watching a movie and zone into the movie, I know I'm going to be able to get this done in 2 minutes, right? If the patient won't sit in the chair, if they are worried when I put topical in their mouth, if they're jumpy or anything like that, then I know this is a patient that I'm gonna need to spend some more time with. So you just kind of have to assess what they're doing. So if I do have a patient that is jumping at what I'm doing, then I'm talking them through everything that I'm doing. And also, I think the biggest thing too is just validating them.
mhm.
Nothing will flip a kid quicker than if you, one, lie to them and say, "Oh,
Tell
no, it's
us
not gonna
more.
no, 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 nothing's gonna
Oh,
hurt. This
mm-mm.
doesn't hurt at all." That's a lie. That's not
Mhm.
true.
They're gonna
They
see it. They can
they
sense
know.
it. They have
Yes.
Paw Patrol
So
sensing.
Yes. Mhm,
yes, and so if they ask me,
Nice.
"Is this going to hurt?" I'll say, "Sometimes it can feel a little scratchy." The most important thing is that you just hold really still like a statue. That's usually
yeah,
my
same.
wording, is just like that. And then just validating. So if they give me some kind of reaction and I say, "Oh, and I right when I'm giving that injection, I say, "Yeah, I think you're feeling that. You're doing so good. Can you go for 3 more seconds?" So especially if
Mhm,
I'm doing like an infiltration on the top or something, I'll give a little injection. If they're like jumpy and I think it's not going to be safe to continue, I just give a little bit right at that injection site, like a little stopper full, 3 seconds, and I count for them too. "Okay, we'll do 3 seconds and then we'll take a break, okay?" And so that's kind of something that I do.
mhm,
Take a break and then see how they
mhm,
do. Because a lot of times you can get back in there, give another penetration, and they don't
mhm,
feel it as much too. Sometimes if it's on the bottom, like for an IA, I don't usually like to do multiple penetrations on an
mhm.
IA just
Yeah.
because there's so much tissue. You're
Yes.
going through all that muscle, and so if I'm in there for an IA, then I'm saying, "Okay, we're doing it," and I try to get it done. And that's kinda nice. So, it kind of depends on if they have work on the top and the bottom too. Like, on the bottom, I'm like, "Okay, we're gonna block it, do an IA, duolingual and a long buckle. We'll be done in 1 minute." So then I can tell them that too. "It's gonna take 1 minute. You can do this. I'm gonna count down." And then as I'm going to, I say, "Oh, you're probably feeling that. It's that bubble
Mhm,
stretching right now. Okay, we're halfway done. Okay, we have 3 seconds left. 3 more seconds. You can do this." And again, but it's a lot of validating words. Again, I'm never going oh, don't do that, or why are you moving? Or sometimes
Mhm.
parents will do that too. And that's another
Mhm.
thing is just
Right.
managing parents jumping in and being like, oh, is it hurting them? I'm like, could you stay over there? So it just
Yeah.
depends on
I
the
think
patient. But
another thing too is kids don't like being I mean, they like being in control of what's going on. So giving them a little bit of control, like, telling them that if anything's bothering them too much, they can raise their hand. That way, say, well, and then add on like, just you just have to hold still, but you can raise your hand. So that way they know that like, okay, I can let them know that I'm not okay, but I don't need to jump out of the chair real quick. So,
Yeah, giving them something that they can do.
yes.
Like,
Uh-huh.
don't wiggle your like instead of don't do this, don't do that. Say, oh, you
yes.
can wiggle your toes or you
Mhm.
can wiggle your fingers,
Mhm.
and otherwise
Yes.
they're wiggling all their
Mhm.
legs, and then your whole body's
Yeah,
moving.
and sometimes I'll
Hmm.
even hand them the
Yeah.
suction, like, "Hey, will you be my helper? Can you put this in your mouth and, you know, and be my little helper and suck out any of the water or anything?" So, giving them some control that way is really helpful too.
Hmm.
Yeah. Another thing I never do either is I don't say sorry to patients, because if I say sorry to them, then that implies that I've done something wrong. I haven't done anything wrong by getting them numb. It
No.
doesn't feel great, but I'm trying to help them get through the appointment. And that not only helps them know that I'm not doing something wrong, but it also helps me because it's hard. It's so
Mm.
hard to do this to little kids. It can be really taxing emotionally to have to do it. Like, it
Mhm,
sucks
mhm.
sometimes. And so I try to stay in a good headspace too of not saying sorry, and I say thank you to
Yes.
patients
Mhm.
instead. So thank you so much for holding so still while I'm doing
This
this.
is
I know this is
excellent.
really hard. Thank you. Thank you for being such a great patient. You did really good. That's the hardest part. You did it. Now your mouth is numb. The dentist is going to come in. He's going to spray some water. So, and that helps
Mhm,
me a
mhm,
lot, just to be able to not get in a sorry. Oh, I'm so sorry that I did this to you. Oh, I'm sorry.
mhm.
Mhm.
Because then you'd get that energy, and then the patient will react to that too. And they'll be like, yeah, you should be sorry. Like,
Yeah, man, that did hurt.
Yeah. Mhm,
exactly.
mhm,
So what did you say? Said thank you to them. They
mhm.
also feel a sense of pride in themselves too. They're like, oh yeah, I am
Yeah,
holding.
you're welcome. I do have a bubble in my cheek. I did it.
Yeah.
Yes, yeah.
Yeah.
Lindsay's the
Mhm.
master of words, of using positive words. I don't know, just you have to say things right, and she's really good at that.
Well, it's kind of like that mindset, right? And I mean, Lindsay, you kind of skimmed over this a little bit, but I'm fascinated to know about the parent situation, right? Like, because again, those words, a parent can say a triggering word,
Mhm.
and then it could just derail the whole appointment. You're like, come on,
Mhm.
man, I was just trying to do this, and now you just push me back, this much. So, has there been ever a story, maybe? And I don't know, tell me more. Do you guys have the parents in the room? Do you kind of politely ask them to leave, ergo kick them out? Or how does that work in the day to day?
Yeah. So in our office, we do allow parents. That's
Mhm.
important for our doctors. It's important for
Yeah.
us too. And it does depend on the kid. Sometimes they do really great when the parent's in there. Sometimes they do worse. I think the biggest thing is that as soon as the patient comes back, I am taking charge of what's going on in the chair. So as soon as they get back, I say, okay, we're going to lay your chair back. What movie do you want to watch today? Which also gives them power right away. And also lets me see if they're going to sit in the chair. And then once they're laid back in the chair, got some earplugs in, then I start talking to the parents and I say, okay, this is what we have planned for today. Usually with those earphones in too. So maybe they can't hear, maybe they're zoned in. Sometimes they can still hear. But again, I'm also just assessing. And then I'm telling parents, here's what we have planned today. Your child needs a filling on the upper right side. My name's Lindsay. I'm the dental hygienist. I'm going to be getting their mouth numb. And then the dentist is going to come back and he'll work on those teeth. Have they had this before? Or if I look at the chart and say, this is their first time doing this, how do you think this is gonna go? But I'm keeping it pretty neutral too, because I don't want the patient to be like, "What are we
Mhm,
doing?" You know?
mhm.
So I'm just kind of asking it casual questions just to see, and then kind of going from there to see what parents say. They're like, "Oh, yeah, this is the first time. I think they're gonna do good," or, "No, this is their first time. They got shots at the dentist," or, which
Yeah.
or at the doctor's office, which is that's one of the worst things a parent can
Mhm.
say is bring up, or they'll bring up their own
Yes.
trauma too. I
Right.
hate the
Or
dentist.
Yeah.
or
I
that they
hate
showed 'em a YouTube video on what's gonna go on. Oh. That's
You're
Yeah.
like, which YouTube video? Little Shop of
Yeah,
Horrors?
it's
Like, what did you
like,
Yeah.
What did you show
Mhm.
them?
but I just try to take control of it so I can control the conversation so that they aren't bringing up those things.
Great. And
And
if they
so they'll be
do, I'm thinking in my mind, how do you shift? They're like, I told them they were going to get a shot. And then do you say, okay, I'm going to get them numb. So we'll be using some different, do you just say, "Oh, we'll be using some different words?" Or how do you transition from, I just showed them a video of an injection going through a cheek. Good luck.
Mhm.
Like what kind of is that shift into that type of talk of shot, ouch, to this is gonna be a really nice experience.
Mhm. I usually shift it back to, yeah, I say they will need to be numb. If a patient outright asks me if I'm getting a shot, I always say, "That's a really great question. I think we need to look in your mouth first and
Mhm.
see."
Yeah.
I'm like, sometimes we do, sometimes we don't, because
Yeah.
that's true. Sometimes I'll get in there and, like, if it's a occlusal on something, sometimes we don't
Yeah.
have to numb them, especially on
Right.
baby teeth. So I'm never outright saying, "Yep,
Mhm.
for sure." To parents, I'm kind of going, just I'm pointing at the thing behind them where kids can't
Mhm.
see. Like, here's the syringe. I'm going to be getting them numb, like kind of making some eye contact with parents. So then they kind of know too. Oh, okay. Like this is how we're
Mhm.
saying
So you
this.
find that parents generally follow your lead of, "Oh, numb. Oh, bubble.
Mhm.
Oh, I
Mhm.
see." That's
Uh-huh.
not I'm just curious if you ever have a patient that's like, "I want to be honest with
Yes.
my child,
Mhm.
and I told them
Yeah.
Yes.
that they are going to get."
Yeah.
Uh-huh.
We
Okay.
definitely I mean, that's
Yep.
definitely happened before. Parents will walk in and say, "I've told them everything that's gonna go on." Sometimes the kids are great with it, sometimes they're not. And if they're not, it honestly, it just you just have to see how it goes, you know? Like,
Uh-huh.
take it step by step. I mean, once you get to that point, it's just behavior management, it's what can I do? What can I throw in to make this a better experience? What can I do to get their mind off of it? And if they know exactly what's going to happen and they're not okay with it, it's a lot of talking them through it. Like this is going to be just a second or a few seconds. We can do this to make it feel better. I can have my assistant spray some water. You can do this. Like it's just a lot of positive talk and most of the time kids can get through it. And that's one of my favorite things is that one when they are terrified and they know what's going on and then afterwards they're like, "Okay, that wasn't so bad." And then I'm like, "Yeah, see, you can do that. You can do hard things. You did awesome." And my other favorite thing is when they're like, they have no idea what's going on. They have no idea they just got a shot. And I'm just like, yes, it's the best. But
Oh,
yeah.
wow. Have you guys, because parent guilt is a real thing, right? Have you guys ever experienced a parent voicing their guilt? Oh, had I pay attention to my child more or taken them to the dentist more, we wouldn't be in this
Hmm.
position. Has that ever happened to you? And if so, how do you kind of like reassure them that obviously we can't take back, we can't cry over spilled milk, but here's what we can do moving forward as hygienists, as preventive
Hmm.
specialists?
Yeah, that definitely happens a lot. I've even seen parents cry about it.
Mhm.
I feel like, again, validation is just huge. Like, I have my own kids. I know how hard it is to brush their teeth. I know that they like to snack on goldfish every 5 minutes. I totally get it. And, telling them that, like, we have parents come in here all the time and we see this all the time. And it's really hard. It's hard to get in there and do that. But now, like, now you're aware of it. It's good that you're here and we're taking care of it now, but now we can give you the the steps and we can give you some education on what you can do to prevent this from happening again. So, I mean, really it is common. Kids get cavities, they can get it quick. They can get them really quick. And
Okay.
Mhm.
so, yeah, just validating them and I think that's the biggest thing for me at least. So,
Yeah. Sometimes on the flip side too, we do have parents, which I probably need to find a better way to mitigate this beforehand. But we do have parents that come in, and I wish they would say this. So spread the word. If you're a parent, don't say this to your kid. But when they're getting stuff done, they say, "See, you should
mhm.
have brushed your
Mhm.
teeth."
Uh,
Very
Mhm.
unhelpful. Not super motivating for a kid who's frustrated. And also, it's not that easy. It's really not that easy to
There's
just
so
brush.
Mhm.
many,
There
so
are,
many
know this,
the
so many factors.
factors. Thank you,
Yeah.
Lindsay. So many factors that contribute to
Mhm.
getting a cavity,
Yeah.
mouth
Yeah.
breathing,
Yes.
Diet,
Yes. And we explain that
and
I mean,
too.
even
Like
medications
this,
too.
yeah,
medication.
it isn't just a brushing thing. It's a, we definitely try to explain what we can and, help them where we can. But yeah, that's just so many different factors that play into that. So making sure that they're aware of that and just doing their best, honestly. So,
Yeah. So usually if a parent says that too, then I'll say brushing is really important, but then there's some other things too.
And
And then
here
it
are
can
some.
lead to more education, like, okay, let's talk about some things that we could work on after I'm done with the procedure though. I
Fair,
mean,
fair.
in the middle of the procedure, I'm like, no, don't say that. And no, I hope no other professionals are saying that either. Like if you're getting, well, should have brushed your teeth, it's not helpful.
Give
Yeah,
give people things to take action instead of take shame and
exactly.
guilt.
Yes, that's never helpful.
Yeah.
Mhm.
I appreciated when we were getting ready for this opportunity to talk with people who do injections every day, all day long on the pediatric population. Brittney sent me something that I think would be a great thought to land on as we close. And she said that preparation, not panic, and learning to roll with the punches is the key to creating safe, positive dental experiences for kids, families, and dental teams alike. And I just want to thank the both of you for sharing your practical everyday, this is what it looks like in the doing. And there are a number of different approaches to giving injections to children. And I hope that you took something away from their experience to try tomorrow or the next time that you give an injection, or one day, crossing our fingers in Florida, that you can give an injection to
That
on
would be
pediatric kids.
amazing.
I think Dave could do
Oh,
it
for
at a
We
pretty
could
sure.
do it.
For sure.
I think Dave could do it. Yeah.
I,
I know he could.
Yeah.
I love that. And guys, thank you so much for joining us in this episode. And really, the listeners that are out there and they're hearing your story, just like me, maybe I'm motivated to make something happen here in Florida, but a parent like me as well. We all we all work in dentistry, and we have heard this comment that people avoid us because there's trauma,
Mhm.
right? And the fact that you guys are those hidden tooth fairies, bicuspid duels that are like
Magicians.
day in magicians,
Molar
yeah,
magicians.
the molar magicians that are day in and day out, avoiding and preventing, furthering that trauma in children, right? I think that's extremely impactful, and I really, really appreciate you guys doing that each and every single
Yeah.
day.
Yeah. Yeah, I think just learning to
Thank you.
slow it down, know that be confident, you know what you're doing. Yeah, just I think slowing it down and trying to make the appointment fun and is one of the biggest keys for kids. So,
And one of the most rewarding parts
absolutely.
too, because again, it doesn't always
Mhm.
go great and it can be really,
Mhm.
really hard
Yeah.
emotionally, especially when kids are, there are times I walk out of rooms and I'm
Oh,
shaking.
for
My
sure.
hands are shaking like
Yeah.
because it's hard to stay emotionally regulated yourself
Mhm.
while also helping a child and their
Yes.
parents stay emotionally
Mhm.
regulated
Yeah.
too. So it's a hard job, but rewarding when you get a patient numb and then they're good for the rest of the appointment, or they come
Mhm.
back in 6 months and they're okay to sit in the dental chair. That's really what it's about.
And to have
It's
practitioners that are making a concentrated effort to be better at what they do every day. And thanks for being an example of that.
Oh, thank you.
it's
It's fun. It's
magical.
the best.
Real quick, if dental anesthetic was a magic spell, what name would we give it?
A medic spell.
Yeah, like a Harry Potter spell, like Lumos, or you
Oh,
know what I
Yeah.
mean? Am I nerding out too much about this?
Oh,
Just
No,
what
wow.
would you
I
think
mean,
would
that
be
would
a
be
I'm
spell?
trying to
amazing.
think of
Harry Potter fan. Agree.
um, I'm like,
It'd have to be something anesthesia
anesthesia.
theory or something.
Anesthesia. You walk. I love how you just literally just went your
Yes.
rest. You were
I
like,
I
Lindsay has
did
a
have a
wand.
wand. I need a wand.
There you go. But you gotta be careful because is it anesthesia or is it anesthesia?
Mm,
Oh,
that's
oh yeah.
important.
great question.
Yes.
Oh,
And it's
Yep.
important. You're
Mhm.
going to end up with something that you didn't
Yep.
want.
Mhm.
If
Like
Yeah,
Laviosa,
exactly.
right?
I know,
Exactly.
there you
Yeah.
go. Well, thank you
Where's
guys for being
Hermione when
with
you need
us.
her?
Well, I'm getting there. I'm getting
Yes,
there.
you have the hair.
I'm getting there. Thank you guys.
Thank you. It was a pleasure.
That's a wrap on today's episode of A Tale of Two Hygienists podcast. If this conversation made you feel seen, inspired, or even just a little fired up, share it with a fellow hygienist or fellow dental professional. Share it with your neighbors, your friends. Share it with everyone. That is how this community grows.
Make sure you subscribe, leave us a review, and connect with us on social media so that we can keep on going with this conversation. Remember, your career, your voice, and your story matter here. We're David,
And Jessica,
and until next time.
keep learning, keep laughing, and keep showing up for yourself and for each other.
This has been a production of Endeavor Business Media, a division of Endeavor B2B.